In this series, we are here to help you clear your NMC CBT exam. Every alternate day, we'll present you with 20 multiple-choice questions and their answers to boost your knowledge and to supercharge your progress. We've got a weekly master video with a whopping 120 MCQs. Don't miss out on this opportunity to excel. Let's dive right in. Question 41. Which of the following is not a part of the 6 rights of medication administration? Option A, right time. Option B, right route. Option C, right medication. Option D, right reason. The correct answer is D. Question 42. Which is the first drug to be used in cardiac arrest of any etiology? Option A, adrenaline. Option B, amiodarone. Option C, atropine. Option D, calcium chloride. The correct answer is A. Question 43. Independent advocacy is: Option A, providing general advice. Option B, making decisions for someone. Option C, care and support work. Option D, none of the above. The correct answer is D. Question 44. What is the clinical benefit of active ankle movements? Option A, to assist with circulation. Option B, to lower the risk of a DVT. Option C, to maintain joint range. Option D, all of the above. The correct answer is D. Question 45. Examples of offensive or hygiene waste which may be sent for energy recovery at energy from waste facilities can include: Option A, stoma or catheter bags. The management of waste from health, social and personal care RCN. Option B, unused non-cytotoxic, cytostatic medicines in original packaging. Option C, used sharps from treatmenting cytotoxic or cytostatic medicines. Option D, empty medicine bottles. The correct answer is A. Question 46. A nurse documents vital signs without actually performing the task. Which action should the charge nurse take after discussing the situation with the nurse? Option A, charge the nurse with malpractice. Option B, document the incident. Option C, notify the board of nursing. Option D, terminate employment. The correct answer is B. Question 47. When should adult patients in acute hospital settings have observations taken? Option A. They are admitted or initially assessed. A plan should be clearly documented which identifies which observations should be taken and how frequently subsequent observations should be done. Option B. When they are admitted and then once daily unless they deteriorate. Option C, as indicated by the doctor. Option D, temperature should be taken daily, respirations at night, pulse and blood pressure for WHO. The correct answer is A. Question 48. The CQC describes compassion as what? Option A, intelligent kindness. Option B, smart confidence. Option C, creative commitment. Option D, gifted courage. The correct answer is A. Question 49. The code contains the professional standards that registered nurses and midwives must uphold. UK nurses and midwives must act in line with the code, whether they are providing direct care to individuals, groups, or communities, or bringing their professional knowledge to bear on nursing and midwifery practice. In other roles, such as leadership, education, or research. What four key areas does the code cover? Option A, prioritize people, practice effectively, preserve safety, promote professionalism and trust. Option B, prioritize people, practice safely, preserve dignity, promote professionalism and trust. Option C, prioritize care, practice effectively, preserve security, promote professionalism and trust. Option D, prioritize care, practice safely, preserve security, promote kindness and trust. The correct answer is A. Question 50. In spinal cord injury patients, what is the most common cause of autonomic dysreflexia, a sudden rise in blood pressure? Option A, bowel obstruction. Option B, fracture below the level of the spinal lesion. Option C, pressure sore. Option D, urinary obstruction. The correct answer is D. Question 51. How do you test the placement of an enteral nasogastric tube? Option A, monitoring. Option A, monitoring bubbling at the end of the tube. Option B, testing the acidity, alkalinity of aspirate using blue litmus paper. Option C, interpreting absence of respiratory distress as an indicator of correct positioning. Option D, have an abdominal X-ray. The correct answer is B. Question 52. After finding the patient, which statement would be most appropriate for the nurse to document on a advocacy incident form? Option A, the patient climbed over the side rails and fell out of bed. Option B, the use of restraints would have prevented the fall. Option C, upon entering the room, the patient was found lying on the floor. Option D, the use of a sedative would have helped keep the patient in bed. The correct answer is C. Question 53. Why are support stockings used? Option A, to aid mobility. Option B, to promote arterial flow. Option C, to aid muscle strength. Option D, to promote venous flow. The correct answer is D. Question 54. During enteral feeding in adults, at what degree angle should the patient be nursed at to reduce the risk of reflux and aspiration? Option A, 25. Option B, 35. Option C, 45. Option D, 55. The correct answer is C. Question 55. To whom should you delegate a task? Option A, someone who you trust. Option B, someone who is competent. Option C, someone who you work with regularly. Option D, all of the above. The correct answer is B. Question 56. A nurse is leading a program about management issues. The nurse would intervene if a ward nurse made which of the following statements? Option A. It is my responsibility to ensure that the consent form has been signed and attached to the patient's chart prior to surgery. Option B. It is my responsibility to witness the signature of the client before surgery is performed. Option C. It is my responsibility to answer questions that the patient may have prior to surgery. Option D. It is my responsibility to provide a detailed description of the surgery and ask the patient to sign the consent form. The correct answer is D. Question 57. After a lumbar puncture, your patient becomes unconscious. What will be the reason? Option A, increased intracranial pressure ICP. Option B, headache. Option C, side effects of medication. Option D, cerebral spinal fluid leakage. The correct answer is D. Question 58. Anti-embolic stockings an effective means of reducing the potential of developing a deep vein thrombosis because Option A, they promote arterial blood flow. Option B, they promote venous blood flow. Option C, they reduce the risk of postoperative swelling. Option D, they promote lymphatic fluid flow and drainage. The correct answer is B. Question 59. Patient is prescribed metformin 1,000 milligrams twice a day for his diabetes. While talking with the patient, he states, "I never eat breakfast. So I take a 12-tablet at lunch and a whole tablet at supper because I don't want my blood sugar to drop." As his primary care nurse, you Option A, tell him he has made a good decision and to continue. Option B, tell him to take a whole tablet with lunch and with supper. Option C, tell him to skip the morning dose and just take the dose at supper. Option D, tell him to take one tablet in the morning and one tablet in the evening as ordered. The correct answer is D. Question 60. In what order should the 4 phases of wound healing be? Option A, inflammation, proliferation, hemostasis, maturation. Option B, hemostasis, inflammation, proliferation, maturation. Option C, proliferation, hemostasis, maturation, inflammation. Option D, maturation, inflammation, proliferation, hemostasis. The correct answer is B.